It's a pleasure to welcome everybody this morning. This is a great event. My name is Fred Myers. I'm the Vice Dean of the UC Davis School of Medicine and a member of the executive leadership team here at the UC Davis Health System. It's a great day. Today we are launching the Behavioral Health Center of Excellence at UC Davis. This is something we've been working on for a couple of years now with Senator Steinberg and with our colleagues at UCLA. But I want to just take a moment to reflect what probably all of you are thinking about, that a center of excellence in mental health and behavioral health is a very personal thing. I dare say that if we went around the room, each and every one of you has had a family member, a friend, someone close to you who has been touched by behavioral and mental health issues. You know, for me, my career in cancer medicine and the integration of palliative care underscores one of the major themes of this center, and that is the artificial separation of physical health and mental health is something we need to really erase and strive to understand that is not, that erodes good health and good public health every day. The average lifespan of patients with significant mental illness with schizophrenia is 25 years less than the general population. And you know that people with significant physical illnesses, cancer, diabetes, COPD, their physical health is eroded by the emotional and mental health issues that they have and that their family has. And it's really the commitment that we have as health professionals, our schools of health, to really change that quality of health and public health that brings us here today. Now, what's interesting and exciting is in academics, we usually start with basic science and we move to some early translational science and then clinical trials, and we make findings, and it takes about 15 to 25 years, and then we go to our advocacy and legislative leaders and say, hey, we think we have something really great, and we'd like to see the laws changed to really take into consideration our findings in academics. That's not the case today, is it? This is really the leadership of the legislative branch, our advocacy groups, our patient advocacy groups, the university, community engagement, all coming together simultaneously rather than sequentially to be committed to make a change in the quality of care and public health in mental health in California. And we've got a big job to do. And I want to talk about that for a couple of minutes with you. I do want to introduce a few colleagues and special guests today. You're going to hear today from three very important, very special individuals. Senator Darrell Steinberg will be joining us in a moment. All of you know that he is the champion in California, in the country, for mental health reform and care. And it's really his leadership that has really changed California and is the inspiration for us to continue the work that he started. We're going to hear from Ralph Hexter, Provost of the University of California, Davis, who will talk to us about the perspective of the entire university. And then we'll hear from Bonnie Holtz, my new best friend that we've been talking to, who has seen firsthand the impact of discoveries of how research and excellent clinical care has impacted her family and herself, particularly through the SAC-EDAP program led by Dr. Cam Carter. We have a lot of other special guests here today, and I just want to acknowledge Vice Chancellor and Dean Julie Freischlag, my boss here, as well as the rest of the executive leadership team at UC Davis Health System, Della Della Torre, the Vice Chancellor for Student Affairs, my new friend, Peter Wybrow, Professor and Chair of the Department of Psychiatry at UCLA and Director of the UCLA Summill Institute for Neurosciences, Harris Lewin, the Vice Chancellor for Research here at UC Davis and a close colleague in many of the things we do, Ken Wells, who's Director of the Center of Behavioral Health Services and Society at UCLA. We couldn't have done any of this without Senator Steinberg's hardworking staff who have been committed to this, including Darby Kernan and Lou Vizmara. Dr. Lou Vizmara, we're very appreciative of everything you've done. Assembly member Mariko Yamada, who is a passionate supporter for better health and health care, and faculty member emeritus, Richard Pan, Assemblyman Richard Pan, there he is over there from UC Davis. Carrie LaCosta, who's representing Congresswoman Doris Matsui's office. There she is. Hi, Carrie. And Brendan Ida, who's representing Senator Boxer's office. Thank you, Brandon. And Uma Zukovsky, who's the Behavioral Health Director for Sacramento County. See Uma here, there. Hi, Uma, how are you? This is one of the things we want to emphasize is the close relationship between the university, the county, and really the dramatic effects all up and down the state that Prop 63 and the Mental Health Services Act has really done, and we're grateful for all the support that you've given us. Jessica Cruz, who's the Executive Director of the National Alliance on Mental Illness. Jessica, thank you so much for being here this morning. And we have a lot of other people, including many of our students, residents, medical students, nursing students, graduate students here at UC Davis who are intimately involved in the research and clinical care that we deliver. And it's that junior generation who's going to make the changes, carry on with the enthusiasm and passion they have that we know that's really going to happen. Well, what's this all about? I've already commented about the personal impact that mental illness has on all of us. And I've talked about kind of this unique advocacy coming together with the university, that's really about innovation. But it's a big challenge, and all of you know that. We know that systems of care in the United States around mental illness are tremendously eroded. We know that there are barriers to care. We know that this impacts all of society. There's an erosion of emotional health, cognitive health, and in fact, the economic fabric of our society is eroded when we have mental health issues. We know this is a huge example of disparities in health, that there are inequities up and down this state, people not getting good care, timely access, and that this evidence of health disparities and an evidence of exclusion rather than inclusion is not something that we can be proud of. Our systems don't work, and these kind of disparities are really impacted on a daily basis. So we know that mental illness has a huge impact on our society as well as on our individual families. And we're here today because we want to do better. We want to have an impact. We want to change the situation. We're impatient. We're not ready to settle for the way things are. And I think that degree of impatience, as we've met with Senator Steinberg, is about putting patients and communities first. The diverse communities that make up the rich fabric of California deserve better care, better public health impact, and we can do that by forming new coalitions, by being innovative. And that's really the vision that we all have for these two centers, this one center up and down California. And we really have three themes that we've talked about. One is closing the gap between what we know and what we do. We have a lot of knowledge about how to improve mental health and behavioral health interventions, but it's not in the community where it's needed. And we also don't listen to our communities about what they need and how we can adapt our interventions to the needs of the communities. We intend to close that gap. Second of all, and you'll hear from Senator Steinberg, who's passionate about innovation in neurosciences. We need the next generation innovation in neurosciences and mental health to take us to places where we're not right now. And that does start in some of our basic laboratories and some of our early innovative areas. And that, the rich fabric of neurosciences that you'll hear, that you could talk to Dr. Carter about, is something that really very enthused about. And then finally, the other theme is really public health, that we can collaborate with the California Department of Public Health, community-based organizations to really change not only the stigma, not only the economic impact, but the public health that mental health has in this state. And we're very, very committed to that. We're going to combine all those themes with workforce development, both here at the university and in the community, to help people better understand, cope, and develop careers, whether it's graduate students at the university, medical students, or police officers who are on the front lines on a daily basis, meeting people who have significant mental health illnesses on the streets, and where we can help them and they can help us to understand what their needs are. we really are here to serve all of the people of California. It is about inclusion and equity in what we do on a daily basis. There are a lot of other things that I could talk about, but I'm not going to go on any more than I have this morning. We are dedicated to having this organization be for everybody, and that we will very carefully lay out our grant program in ways that will recombinantly put people together where they haven't perhaps been working together before, and it's through that type of innovation will stimulate the type of changes that we're all dedicated to for mental health. It's a landmark funding, and Senator Steinberg, we're incredibly grateful for everything you've done to stimulate this. Dr. Cameron Carter, who's a professor of psychiatry, is the designee executive director of this center, and along with the rest of us will be strategically developing initiatives and plans to utilize this remarkable amount of money, $7.5 million, where we intend at the end of 2.5 years to show all of you, we hope you'll come back in 2.5 years, mark your calendars, and say, yes, together we did something important, and let's do it again. So we've got a lot to look forward to. So I'm very excited about what we have here, and to share that excitement, I'm pleased to ask the UC Davis Provost, Ralph Hexter, to join me here. The Provost and Executive Vice Chancellor is the Chief Academic and Operating Officer for all of UC Davis. It's a big job. He does a fantastic job. We're glad he came over here. Thank you.
Thank you very much, Fred. I'm delighted to be here with all of you today for this important moment for the health system and all of UC Davis. As all or most of you know, UC Davis has what I would call a foundational document entitled A Vision of Excellence. It's foundational because it lays out our university's top-level goals and guiding principles, and thereby it serves as a yardstick for institutional evaluation and a roadmap for where we want to go. It describes how we aim to preserve and advance our excellence as we pursue our mission to serve our region, California, and the world through teaching, research, and public service. One of the top-level goals articulated in a vision of excellence is to champion health, education, access, and opportunity. Another one is to drive innovation at the frontiers of knowledge. Both of these goals, it's clear, are at the heart of this new Behavioral Health Center of Excellence, which means that this new facility will contribute to our university's excellence and mission in direct and important ways. As Provost, I'm proud to acknowledge that UC Davis, having begun over 100 years ago as a farm school of the University of California, is today a leading comprehensive teaching and research university and internationally renowned in so many areas. I'm both proud and excited that this renown continues to grow thanks to our extraordinary campus community, our exceptional alumni, friends, and external partners, and critical facilities such as this one. One of the things that our university is known for is the premium we put on collaboration in all aspects of our work. Not only are we skilled at crossing disciplines and breaking down silos in our research and education programs, heck, we can even cross the causeway. We're also involved in a broad range of innovative programs, in other words, in collaborations with external partners. This habit of collaboration will serve the new center well as we strive to strengthen our external partnerships, including those with the organizations and leaders represented here by our distinguished guests. The center's research program will further develop such partnerships with the counties of Northern California, the Veterans Administration, other health organizations, and government institutions. In the process, they will increase our research opportunities and grow our workforce. Another defining strength of UC Davis, which I will just mention here, it's such a big one, is a deep, deep commitment to social justice. In the health system, this commitment can be seen in the equitable and inclusive health services it provides to diverse communities, as well as the curricula that teach students to consider society's needs in all that they do. We're deeply grateful to Senator Steinberg for both his leadership and wisdom in authoring the Mental Health Services Act, a $1 billion system for dynamic mental health care for the people of California. We're also grateful for his partnering with UC Davis to establish this center. It's, again, with pride that I acknowledge that Senator Steinberg earned his law degree at UC Davis's School of Law. Surely we cannot take full credit for his passion for improving society, but I like to imagine that at the least that passion was nurtured, informed, and directed by his experience at King Hall. It's no exaggeration to say that Senator Steinberg has been a relentless advocate for the advancement of mental health care, calling it, and I quote, "the underattended issue in our time and in our society." In recognition of his extraordinary efforts and commitment to address this issue, he's been heralded within the mental health community as the most transformative figure mental health has ever seen. I know you're eager to hear from Senator Steinberg, and he's eager to speak to you, so let me end my remarks now and give him an introduction that's at least partially fitting. Senate President pro tempore Darrell Steinberg is the majority party leader in the California State Senate. He's represented Sacramento since 1998 in the California legislature, earning a reputation for confronting seemingly intractable problems and delivering results. In 2010, he was honored with the John F. Kennedy Profile and Courage Award by the Kennedy Library Foundation in recognition of his leadership in a very challenging effort, the bipartisan negotiations that led to the state's fiscal recovery after it faced a $42 billion deficit. Senator Steinberg is widely recognized for working on and resolving many other tough issues as well. There's his work, for example, on SB 946, which mandates that insurance companies cover treatment of people with autism and related disorders. With good reason, he was identified by the Wall Street Journal as one to watch in 2013. Senator Steinberg, we're watching you in 2014, and we look forward to watching you in 2015 and many more years to come. We welcome you today.
Thank you very much, Provost Hexter. That was a very, very kind introduction, and I'm humbled. And every bit of work I've had the privilege of doing over the many years has been my honor. To have a limited period of time in life, and that's what term limits are about. I suppose life itself is term limits. To be able to focus on a few, maybe more than a few things that really matter, and to make a difference. That's what it's about. And I leave November the 30th, October the 15th, with the satisfaction, partial satisfaction, of knowing that we have planted a lot of seeds. And this is certainly one of the large and fruitful seeds, I am sure. And so I thank you. And I thank you to Dean Freischlag. Look forward to getting together with you. I thank Vice Dean Myers for your leadership in helping to pull this all together, and my friend Dr. Carter, Cam Carter. I thank the elected officials that are here, Richard Pan, thank you for coming, and Mariko Yamada. I thank Jessica Cruz from NAMI, and I know I'm going to leave out a lot of people, but I want to especially thank my staff. As I know, Dr. Myers did, Darby Kernan and Lou Vizmara, really, who championed this and did an absolutely fantastic job in doing the nuts and bolts that bring us to this day. So please give all of them a big hand. So when we talk about healthcare and we talk about mental health, it's important that we talk about the challenges. But I think it's also important that for just a moment we reflect on the accomplishments here in California, because look, think about it. This is the home of the UC Davis Mind Institute, the leading research and clinical facility in the country when it comes to the research and treatment around autism and developmental disorders. This is the state, the only state in the union, that passed a tax on $1 million earners, tax we should all aspire to pay, as I like to say. to begin to fulfill the promise of building a mental health system in California. And this is the state that is most aggressively implementing the Affordable Care Act. And in doing so, ensuring that mental health and substance abuse disorders, and now autism and early intervention for autism, are fully covered benefits under the Affordable Care Act. That's something to celebrate here in California. This center that we are here to celebrate today, in my view, is the next step forward in our state's collective leadership. This will be a catalyst, more than a catalyst, to improving our understanding of the brain and leading to the discovery sought by so many Californians and their families living with the challenges and the demands of a behavioral or mental health disorder. And as I have said many times, when the provost quotes me as saying this is the underattended to issue of our time, I mean it. This is an issue that knows no partisan lines. It knows no geographical lines. It knows no artificial gender, sexual orientation, age, socioeconomic boundaries that so often divide our society. It is true that everybody knows somebody. And its prevalence is not just about mental health in a silo. It has an inextricable link to everything else that we care about and frankly spend a lot of money on. Criminal justice, homelessness, child welfare, educational disabilities. The list goes on and on and on. Over the past decade, Proposition 63, the Mental Health Services Act, has raised over $9.5 billion for cutting-edge mental health care and preventative care. And the majority of the money is spent on what we call full-service partnerships. It's spent on helping and caring for those who have suffered the most and who are living with persistent, chronic, and serious mental illnesses. And though there is yet to be a full evaluation, that must happen, there have been a series of partial evaluations that have demonstrated significant reduction in emergency room visits, thousands of fewer days in psychiatric hospital care, fewer arrests, more employment. We know that whatever it takes for people who have hit bottom and are trying to recover really works. But what this center represents to me is the opportunity to create the next generation of prevention and early intervention strategies that will reduce the suffering. Because once people are in the system, once they've suffered that first break, they're already suffering too much. If we can prevent that first break, if we can recognize the early signs and treat people early, we can help millions of people avoid the consequence of all of that suffering. So the act itself at times has been controversial, in part because it was intended, of course, to build on a base of that existed in 2004, which was insufficient, but was a base to build upon. And of course, as the $1 billion plus, it'll be $1.7 billion, by the way, in 2015. As the base has grown, we suffered the impacts of the terrible recession and lost a lot of the core funding. And there are critics that say, well, why haven't we delivered on everything that we promised in 2004? And I turn the question around and say, where would we be without the Mental Health Services Act? We'd be nowhere when it comes to the thousands of people benefiting from full-service partnerships. And one of the critiques has been that why are you spending money on prevention and early intervention when there's so much unmet need on the treatment and care side? And I think that's a fair question. But I take it head on. Because when we wrote this act, and when we put this before the voters of California, we said most deliberately, 25% of the money every year must be spent on prevention, early intervention, and innovation. 75% on back-end care. And why did we say that? Because we know that if we don't invest in prevention and early intervention, no amount of money is going to care for all of the people who have fallen through and who are suffering and have been suffering for far too long. And I'm not shy to tell you that I have a broader goal when it comes to the act. Whereas 25% is the minimum amount that must be spent on prevention and early intervention, I hope that this work today represents the beginning of a flip when it comes to the funding in the act. Because whether it's 10 years from now or 25 years from now, 75% of the money must be spent on prevention, early intervention, and innovation, and therefore needing only 25% to be spent on back-end services. What is unique about what we're doing here at UC Davis and what we will be doing in a couple of weeks at UCLA? What's unique to me is that I don't know of any statewide center, or national center for that matter, that is focusing on the cutting edge research around the causes of these mental illnesses: schizophrenia, bipolar disorder, serious depression, anxiety disorders, all of those things that are disabling and prevent people from having a better life. But research itself in isolation is not enough. And clinical practice, while it helps many people and is essential, standing alone is not enough. It is the connection between the two that is lacking, and that this center and the UCLA Center will begin to provide. And we know a lot about prevention and early intervention. We know, obviously, because it's common sense, that intervening earlier creates better outcomes. But I know, and you know, that we have yet to discover all that we need to know and all that we will know. We think about history, and we think about how well recognized Jonas Salk is, for example, and how we take great pride in the fact that polio, as one example, used to be an illness that was life-altering and obviously disabling. We know that we're making great advances when it comes to many physical illnesses, including cancer and heart disease. We must make the same commitment in developing those strategies, those understandings, and those advances when it comes to behavioral health. We can no longer afford to see our emergency rooms filled with 5150 patients that have nowhere to go, where we don't know what to do to help them. We can no longer afford to have 15, 16, 17-year-old kids fail in school and become a statistic because they did not get the help that they needed and deserved early in life. What are we doing here today? We're planting a seed. We're planting a big seed. And it's a seed that I'm confident will grow, because our $7.5 million is going to attract other resources. And we're going to build something that is going to be not only recognized statewide, but nationally as well. Finally, I hope that today marks the beginning of a more concerted effort to build a legislative agenda around improving the mental and behavioral health system in California and in this country. I know on the federal level, Congresswoman Matsui is doing just an outstanding job and has delivered $1 billion of resources nationally to improving the mental health system. I'm grateful for that. I'm grateful for Doris's leadership, and thank her, please. But I know in California that we have a mental health caucus. We've got members that are interested. I know I'm leaving. People will pick up the mantle, I have no doubt. But a couple of weeks ago, after this impactful story about my daughter appeared in the Sacramento Bee, I asked myself, okay, what am I going to do next here to appropriately take advantage of this moment and try to spread the word? And so I was really impressed by this ALS movement, the Ice Bucket Challenge. But I have a thing about, ice being tossed on me, and I think other people do as well. So I decided to put forward what I called my wonky version of the Ice Bucket Challenge. And I put out an email to the incoming legislative leadership, and I said the following. In 2015, I want to advocate that every member of the legislature, all 120 members, introduce at least one bill to improve the mental and behavioral health system here in California. 120 bills. And it doesn't matter to me, frankly, whether all of them pass or become the law. It's sort of beside the point. I think enough of them will. Enough of them will. But the fact of 120 measures, all addressing different aspects of improving this system, would be a very powerful statement and begin to build an agenda and begin to build a budget strategy and begin to take this movement, which I think is a movement, to the next level. You see, I think that stigma, we talk a lot about stigma in this field, has a number of consequences beyond people just feeling alone and not knowing how and where to obtain help. Stigma has a more insidious consequence. Stigma translates to legislatures and governors and presidents and people who are in positions of power to be able to bring more resources and more innovation to this system. Because we're afraid to talk about it, the body politic is afraid to talk about it. And because they're afraid to talk about it, there aren't 120 bills introduced every year in the California legislature and a demand that these issues be a budget priority when it comes budget time. So if we do our work here at UC Davis and throughout the state, if we develop the cutting edge interventions that will show that recovery is not only possible, recovery happens, if we show more success, if more people come out of the closet and talk about this, then policymakers will feel much more comfortable to take this on as a priority issue. And the result will be more funding, more innovation, more attention. And then fewer people will suffer. And that's what this is about, and that's why I'm darn proud to cut this ribbon with you here today. Thank you very much.
Thanks, Reverend. That was great. It's non-denominational. So it's a pleasure for me to introduce a family member and a friend, Bonnie Host, to talk about her experience in this area. Bonnie, thank you.
Thank you. Good morning, everyone. I am Bonnie Hotes. I'm the family partner for SAC-EDAPT, which is the collaborative program between the UC Davis Department of Psychiatry, and Sacramento County to provide state-of-the-art care to youth with early signs of psychosis. This program, which was funded by the Mental Health Services Act, is changing lives. It is. It's changing lives for the better as we speak. Long before a county program was established, however, my family was fortunate enough to stumble upon its predecessor, UC Davis's Early Diagnosis and Preventative Care Treatment of Psychotic Illness program, which is a mouthful. It's a program that was founded by Dr. Carter in 2004 to help kids like my daughter and other young adults in the early stages of mental illness. I can say that our 2 years in UC Davis's care, I believe, saved our child and helped us move beyond survival mode to regaining our footing as a healthy and functioning family. And now, with the combined efforts of Sacramento County and the UC Davis Department of Psychiatry and Behavioral Science, I have the privilege to support other families seeking treatment for their loved ones by helping them communicate their needs to the clinical team, connecting them with available community resources, and frankly, and maybe most importantly, just being someone they can talk to. As the parent of a child recovering from a severe mood disorder, I know firsthand the challenges that families face when a loved one becomes ill. In our case, it crept up slowly. It was masked as erratic teenage behavior until it became too pronounced to ignore. But I've heard many stories from other families where mental illness strikes suddenly and catastrophically. Desperate, obviously, for answers, families urgently seek medical help, only to find there's not a blood test or a scan that can definitively tell you what's wrong. So instead, a diagnosis and therefore treatment can be complicated. It can be really difficult. So we start down this well-traveled but very bumpy road of trial and error that, along with other services like psychotherapy, typically involves medication of some sort or combinations of different medications. Many of these, I'm sure you know, have significant side effects that they muddy the water and then they make an already difficult situation that much more difficult. Most of us learn early on that patience is a virtue in this part of the journey. Most medications don't work quickly. They may require many weeks, even months, to know if they're helping at all. Often, dosages need to be tweaked or medications changed completely, and then the process starts over. Meanwhile, your child's life, as well as your own, is in this surreal kind of limbo that's hard to describe. But imagine your bright, outgoing, and active child suddenly being stricken with a debilitating illness that disrupts their education, derails their friendships, and maybe even threatens their safety due to dangerous behaviors or threats of suicide. Imagine looking into your child's eyes and not recognizing the person there. Imagine even maybe fearing your child because of threatening behavior towards you, their siblings, or other people. This is what our families often face, and many do it alone. Unlike other medical crises, and this was touched on, mental illness is not well understood or accepted. Friends, even family, can be dismissive or critical, assume your child is just a bad kid, or that you're not doing a good enough job as a parent. That one's fun. People may be uncomfortable and drift away, leaving families without the social support normally given generously to those dealing with other types of severe illnesses. We like to joke in our family group, because we have to laugh too, that when your child has a psychotic break, don't expect a casserole. I mean, typically people, you know, aren't comfortable coming forward and asking you what's going on. So what happens? Parents and other caregivers become isolated. Marriages are strained, jobs are lost when breadwinners have to stay home because their kids can't go to school. So the bottom line is our children, our loved ones, they desperately need more effective, targeted treatments that work faster and with fewer side effects. And we, the families, need the extended services that help us help them as they go down their paths to recovery. Because we know recovery is possible. We've seen it happen. And we hold on to the hope that with the advances in understanding these brain disorders, it will become a reality for more of us. And for this reason, I know I speak for many families when I say thank you, and those words just don't say it enough. But thank you to Senator Steinberg, to UC Davis, and to the other leaders in our community for their vision in launching the groundbreaking research that will take place in this new Behavioral Health Center of Excellence at UC Davis. We will all benefit from the innovative work they will do. But while our talented doctors, clinicians, and researchers do what they do best, I'd like to ask you, the community, to do what only you can do. And that is reach out to someone you know today who's struggling with mental illness, either personally or through a family member. Ask them how they're doing. Listen with compassion and without judgment. You can't fix their problems, but you can make them feel cared about and, most importantly, connected. It may seem like a small thing to do, such a very small thing to do, but trust me, it's not. I know personally. Your friendship and support are so important to families struggling with mental illness, and I promise you, it will make a difference. Thank you.
Thanks, Bonnie, for putting the face of courage and our empathy toward what we're talking about this morning. That was wonderful. Come on, let's get in.
Come on, grab, please, everybody grab part of the scissors here, okay? Okay, on three. 1, 2, 3. All right.